Hi everybody, it's Mike here again for another week question for this week. But actually first I want to thank Anuj Argawal, the founder of feedspot.com, for ranking us in the top 30 of critical care blogs or websites on the planet. So thank you very much for that. Another update, our 4-year-old son is still pooping, but he's pooping in his pull-up now. He takes his underwear off, puts his pull-up on, poops, and then contacts me directly. In fact, I just changed him, and I don't know if it's my imagination, I can't get the smell of poop out of my fingers, and I use like 20 wipes. I washed my hands like 20 times with soap and water. I rummaged through the cabinets. I poured bleach on my hands. I had Ajax, Mop and Glow. None of it works. I don't know if it's, maybe it's just my imagination, but I'm not sure. Anyway, so this week's question is not going to turn out well because no matter how I answer it, it's not going to be a good answer. So if I answer it one way, I'm going to be a uncaring health professional. If I answer it another way, or the opposite way, I'm going to be un-American and a traitor. So this question comes up late summer, and I was just discussing the same question with a handful of nurses in the ICU, no pun intended. We specifically discussed this. So this is the question. Should my child play football? That was a pretty simple question. For all those out there, if you understand the concept of football, you have a animal skin, you fill it with air, and your job is to carry it from one end of the football field to the other and score into the end zone and score a touchdown. The only issue is there are a whole bunch of other people that are running full blast at you that want to knock you down to prevent you from doing that. So the concept that I have in my hand, or in my head, is when we're talking about children, is that you can have a 10-year-old that weighs 60 pounds running as fast as he can toward the end zone, and you can have another kid that's 10 years old, but he weighs 140 pounds and is a foot taller, and that guy's running the exact opposite. And then they're going to run directly into each other, which can cause a collision. So that's the concept of football. So now I'll give you some numbers like I always do. I'll give you the objective data, national recommendations, and a personal take on it. So the Orthopedic Journal of Sports Medicine, February 2017, says that recent studies have reported injury rates between 2.5% to 30% per season. So can be relatively high. The Journal of Athletic Training states that football has the highest injury rate for all injuries, for all sports-related injury, and injury occurs more commonly during practice than the games. Okay, the American Academy of Pediatrics, since the 1950s, recommended against anyone under 13 playing football. That was the policy since the 1950s. But you know what happened? Nobody listened to it, because this is America, and this is what we do. We like sports, and we like to be heroes. So what happened was the AAP, I think, realized this. So 2 years ago, they reissued a statement that they didn't say, no, you can't play football anymore. They stopped saying that. So their new statement says, I'm just reading one quote of it, removing tackling from football altogether would likely lead to a decrease in the incidence of overall injuries, severe injuries, catastrophic injuries, and concussions. So I don't know if they're trying to advocate not tackling anymore in football, because that's what it sounds like, but then that wouldn't be football. Unless you can convince like the whole nation to, instead of tackle, to tickle the thighs of the running backs or whoever has the ball so that they'll giggle and fall down. But I don't think that's realistic. So if you want to play football, you have to tackle, or don't play football. So those are national recommendations. Now I can hear all the fathers, boo, boo, who's this pencil neck pediatrician trying to tell us what to do? You know, the muscly fathers with their muscly kids. So, okay, now I'll switch gears. And I'll say something from a personal standpoint because I understand it, because I grew up here in the United States and I know what it's like to want to be a sports hero. You want to hit the home run and you want to hit the last basket in basketball, and you want to get the last goal in soccer and win the game, and score the last goal in hockey. And in football, you want to be the quarterback or the who's throwing the winning pass, or the running back, or you want to catch the winning pass. So that's instilled in all of us. I mean, that's always been my dream ever since I've been a little kid. I think it's all of us, even as adults. In fact, I mean, I still have the dream. I like to be the quarterback and I throw the winning touchdown, and then everyone's applauding for me and the cheerleaders are jumping up and down and hugging me and kissing me. I mean, that's my dream still. I actually shared that dream with my wife, and she told me that if she ever found me with a bunch of cheerleaders jumping up and down on me, that she would castrate me and hang my you-know-whats from the rear view mirror of the family minivan. So I've since sold the minivan, but I still have the dream. I mean, that's in all of us. So I thought, if I were a kid in an office with my parents listening to myself as a pediatrician give me advice, I think I'd be crazy. I would tell a pediatrician, who'd be me, don't take my dream away. This is what I want to do. This is what all my friends are doing. I want to be the hero. So I told you I wouldn't win this question. There's no good answer. I mean, from a logical person, I'm trying to be logical, using my brain. It doesn't make sense to allow my child to increase the chance of getting hurt in some collision. On the other hand, it's the heart of the United States here. I mean, we want to be heroes and we want to be sports heroes. I don't know how you can talk anybody out of that, or especially talk a parent out of that. It's not necessarily the kids, but the parents that want their kids to do well. So I told you I wasn't going to do well on this question. Anyway, I'm done talking. Good thoughts and prayers to everyone out there that are going through so much right now with the hurricanes and the floods and the wildfires. God bless you. I hope you have a great week, everybody.